Welcome to Therapy Thursdays on Louisiana Living. We are physical therapy and balance centers. I'm Angela Yarborough, and this is Dr. Jerry Yarborough.
Hi.
And he's got some good information for us today, I'm sure.
Of course, as always. And what we're going to do today is we're going to continue talking about the 3 most common causes of back pain. And specifically, we're going to be talking about SI joint pain. All right, so what we're talking about is the 3rd most common cause of back pain and sciatica, which is pain that runs down your leg. It is the SI joint pain. S being the sacrum, which is the lower part of your lumbar spine, and then the ilium, which is part of your pelvis, which joins your spine. So sacrum, ilium joined together, forms a joint, and when it gets malaligned, it causes a lot of pain. And the golden symptom of SI joint pain is someone puts their thumb on one side of the low back and says, "My pain is right here." We can almost always be guaranteed that that is SI joint pain. And it can cause a lot of pain, but it is most commonly one of the easier ones to fix. So I want you to try some of this at home. If you put your thumb on one side of your low back and says, "That's where my pain is," try these things and see if it helps. So first of all, we're going to start off with some stretches, because that can be a cause of SI joint malalignment. Trauma is another one. Stepping too hard, stepping like in a hole, or that step was a little bit higher than what you thought. Stepping like that can get that SI joint pain going for you. Now today, as our participant, we have Skylar. She's here from Louisiana Tech Kinesiology Program, and she's going to help demonstrate. So go ahead and lay down. Okay, we're going to start off with a few good basic stretching exercises. So feet and knees are together. You're going to rock your knees side to side as far as you can without causing pain. You're going to keep your shoulders nice and flat. Go as far as you can. Another good stretch is going to be the piriformis stretch. Cross your foot over the opposite knee. You're going to push this knee down away from you. Hold it for 30 seconds, and then pull it up toward the opposite shoulder for 30 seconds. You're going to do each of these 3 times for 30 seconds. And then the hamstring stretch. You're going to straighten that leg out. You're going to keep it straight. You can use your hands behind your leg. Keep your knee straight. Pull it up. Hold it for 30 seconds, and then let it down. All right, you're going to do each leg 30 seconds at least 3 times. All right, now I'm going to show you a way that you can help realign that SI joint. All right, at home, you're going to have a pillow. You can put that pillow between your knees, and you're going to squeeze. You're going to hold it for 10 seconds and do that 10 times. This not only helps strengthen the SI joint, it also kind of helps open it up, getting it ready for this maneuver that we're going to work on here in just a minute. Next, you can use a TheraBand. You can wrap it around, you can hold it together like that, and then push your knees apart, okay? And you can do these in a seated position, all right? You're going to push them apart, nice and easy, 10 times, all right? That helps strengthen that SI joint and open it up for this maneuver you're going to do. Now, if you put your hand or your thumb on your right low back, most frequently it's going to be a posterior rotation. Not always. A skilled therapist would be needed to assess that, but this is something you can try at home. All right, so because most commonly it's posterior, you're going to pull this knee up toward your chest and resist it. At the same time, you're pushing this foot into the better mat. You can also do this in a seated position. I have real tight hamstrings, and this happens to me frequently. I've done it many times, even at a stop sign. So this is a good maneuver to help decrease SI joint pain. And we hope that you've enjoyed our segment on how to manage back pain. And we'll see you next week on Therapy Thursdays.